Welcome to the Caregiver Relief Podcast, the place where we share real stories, resources, and expert advice to support family caregivers on their journey. I'm your host, Diane Carbo, a registered nurse and a lifelong advocate for compassionate, person-centered care. This episode is sponsored by myvitalvault.net, your all-in-one life organizer for aging adults and caregivers. It's designed to help you securely store your essential legal, medical, and emergency information in one easy-to-access place. Because when a crisis hits, being prepared can make all the difference. Join our Caregiver Relief community, a warm, welcoming space where you can connect with other caregivers, ask questions, share stories, and find support from people who truly understand. Visit community.caregiverrelief.com to join now, because caregiving is one of the hardest and most meaningful things you'll ever do, and no one should have to do it alone. And if this episode speaks to you, please take a moment to like, share, or comment. Every click helps us reach more caregivers who need encouragement, resources, and hope. Today, I'm really honored to welcome someone who truly embodies heart-centered healthcare, Dr. Vanessa Grenyion. Vanessa is a licensed pharmacist who earned her doctorate in pharmacy in 2005 and has spent nearly 2 decades serving her community with compassion, integrity, and purpose. In 2016, she founded Health Quest Medical Supply in Fair Oaks, California. And through Health Quest, Vanessa delivers a deeply personalized approach to matching people with the right medical devices, education, and support they need to live safely and independently. Vanessa is also a certified senior home safety specialist, a licensed real estate agent in Northern California, and a Matter of Balance fall prevention coach. All roles that reflect her unwavering commitment to aging in place with dignity. Today, we'll explore the inspiration behind her work, her fall prevention workshops, diabetic shoe fittings, home safety assessments, and how she's making a real-world impact, one caregiver and one client at a time. So let's dive into this conversation with Dr. Vanessa. Vanessa, I want to say thank you so much for joining me today. I know you're taking time out of your busy schedule, and I'd like to start by having you share your personal journey with my listeners. I'd like to share how your upbringing and your grandmother's in Jamaica inspired your work today.
Thank you, Diane, for that beautiful introduction. Right now, it's very close to my heart to work with individuals that really bring about that sense of community, just trying to help individuals that perhaps they are more vulnerable now as they age. And my grandmother, Pearl, and I called her Granny. Now, I was the youngest of the bunch, and she was raising me while my parents were in America. And sometimes you get nostalgic about your childhood, and you remember what your grandma used to do for you. One day, I remember coming home from school, and I was hoping grandma was making one of my favorite porridges, which is rice porridge. And that was on my mind so much. I was running home and I was just thinking about it. And would you believe when I got home, she had rice porridge for me. And it was the best rice porridge I've never had. I've never tried to replicate it. I just remember that was unique for her to do. And my grandmother, also in the US too, it's like you find you have a bond with individuals because of a certain age, because this reminiscence of your own relationship with your grandparent. And so that's where that comes in. And my grandmother used to go to the market in Jamaica. She used to sell produce. She used to garden and farm. And I love to do that now. And she was stern, but she was my rock. And all I knew, mom and dad together for a while until I came to the United States back in the 1980s. So that's part of it. And that carries through anytime I interact with somebody that sees an elderly individual, it is due to that kind of relationship.
I
Not,
love that. I love it. You know what? It's who we are, and it makes us who we are today. So
it is.
I appreciate that. I also had a bond with my grandma Smith, and I understand that when you talk about food, that's again when as we get older, the memories that come back that will, I'm sorry that you don't know how to make your porridge to the degree that your grandmother did. Because it's a fond memory. And but you hear it or you smell it or you taste it, and it just brings you back to a happier time or a time of when she was around. And I love that.
And it's nice to know how certain of those things with food. Now, food, it really cement a memory, a time that stays with you. And I believe I might have been about 6 years old. So it really, really ingrained itself in me because of the food and that relationship with my grandmother. Yeah,
Oh, I
very special.
understand that.
Very special.
I know this is off topic here a little bit, but my grandmother had a big dining room cabinet, and in the cabinet was canisters of candies and stuff. And I can remember as a kid going over and opening up the cabinet and getting candy. And after many years after my grandmother passed, my cousin had gotten her furniture. And it was so weird because the first thing I did was go over and I could still smell the candy and my grandmother, and it just brought all those feelings back. So I love that in a way you're honoring your family by moving forward and encouraging community in your present life, in your present and hopefully your future.
Yeah.
Now, I understand you and your husband both have pharmacy backgrounds. So I'd like for you to share your experience evolving into the creation of Health Quest.
That sometimes you manifest something and you encourage that little seed to start growing. And I believe we were expecting our second child, Maya. It was back in about 2010, I believe around 2010. Now, the idea was to have your own business where you could help people in the way you feel that you can deliver that service. That's
Yeah.
this idea that you are in service to others. Basically, it was on my mind, on my heart to go through with that. And we were looking and thinking about, oh, we can also do the pharmacy and do the durable medical equipment side and go in that direction. Now, as being an expectant mom, that idea was always like that was something that was interesting to have while you're trying to prepare for a child. But we did the research. We knew of a friend who also owned his pharmacy. And as time went along and life happens, you're lifing, go and do your thing. I proceeded to keep that in mind and keep manifesting. And then by the time I got pregnant again with our son, that's when things really started rolling along. I
Mhm.
think he was almost 2 years old when we opened Health Quest. The journey was when I'm, of course, in pharmacy, I found out we're just doing, as my professors would say, lick, stick, and pour. We're lick sticking and pouring, and we're a glorified technician. But we're more than that, too. You have to do consultation. And with me, my supervisor used to say, Vanessa, why it takes you so much more time is because you spend so much time with the customer. And I go, that's part of my job description. I need to consult with the customer. And you really get to find out the issue behind what's going on and the reason as to why someone is on a medication. And then you build trust. And when you can build trust, then they can rely on you for making recommendations that will support their health better.
Yes.
And that was part of it too. I'm like, I'm not going to be a number. I'm not going to just be focusing on the key performance indicator and to say, what's the volume of prescriptions we're putting out today? How many people are we going to have on prescription drugs? Because we're not really proactive about the health. We are actually putting a Band-Aid on the problem. It
Exactly.
doesn't go away.
Yeah.
And I just want to make sure people are aware that medications are a support, but they are not the only option. You have lifestyle modifications. There's so much options for people today, and medication does not really alleviate the issue. The only thing that really cures anything is antibiotics. And then there's other things, but for the most part, I want people to understand that the medication is part of the journey to perhaps a more health conscious way of living. When you think about it, I don't want to be on this medication. How can I make it so that I can not have to take it, whether you type 2 diabetic or you have high blood pressure? Well, that's a long roundabout way trying to explain to you why we started this. But the gist of it is I wanted to foster a community. I want to make sure that not on a time crunch. I want to be able to listen to patients. I want to make recommendation and improve their quality of life in a
Mhm.
nutshell. And just bringing it all together, I felt that, you know what? Maybe I'm not more aligned with the pharmacy part. I'm more aligned with the durable medical equipment part. And as well, we termed it home medical equipment so that we can make sure people age safely in their home and still be able to support them as they're doing so, but being able to listen and learn because I'm always doing both. They are teaching me and I am teaching them. And so that's a synergistic thing that I have found over the years that's really allowed me to empower people to be proactive about their health and to
Mhm.
be knowledgeable about the device they're using and just the freedom to do more. And that's basically to be able to help others the way I want to help them.
It seems to me like you've taken personally and professionally, you've combined your heritage, compassion, and clinical knowledge to provide services to your community, and how fortunate your community is to have you. I love that. Uh, on the other note, I just wanna make a side note here to my listeners. If you are on medications and or your loved one's on a medications, I really encourage every 6 months you review your medication list with your doctor. And because this isn't done enough, they keep adding on and not subtracting, and literally asking, "What can I take away or decrease now?" And that's really important, and physicians even aren't proactive enough about that. So, I think I'm just throwing that tip out there to everybody. Review your medications every 6 months and say, "What can I get rid of and what can we decrease over time and totally eliminate?" I'm gonna get on to your home safety and fall prevention plan that you have. So let's talk about fall prevention because it is one of the most urgent issues of aging adults. What prompted you to start offering a fall prevention workshop, and what can families expect from it?
Yes, and the thing is, 1 in 4 Americans age 65 plus and
Mhm.
older fall each year, which is about roughly 14 million individuals, older adults. The bottom line is that what I'm doing is I'm recommending mobility devices, okay? And that's to really minimize people from falling.
Yes.
And that's a big chunk of what I've been doing. The balance issue, the instability issue that older adults face is monumental, not to mention the home is like a booby trap.
Yep.
And the other thing that we have to discuss is the cognition of the individual as they're aging and how sometimes even and we are all risk of falling. That doesn't negate anything because we're a certain age. But the thing with an older adult is that their mind and their body are not in sync. I learned that your mind think you can do certain things. You can turn fast. Your mind say, okay, but your body is slow to react. And
Yeah.
so everything slows down as you age, and you just have to be more mindful, be careful, be slower, and just be more cautious in that area. So when I was curious, I was always curious. I'm like, there's a lot of people needing these mobility devices. And I saw how some of them would try and use it. And I roll later the walker with the seat. And I said, oh my goodness, there's so many people that don't know how to use what they are, what's supposed to keep them safe.
Yeah.
And also, why is this an epidemic in this country?
Yeah.
And talk about getting over the vanity of it all, trying to have individuals go, you need that. Yes, no, this is not appropriate for you. But the simple fact of the matter is that I believe there has not been enough education out there for our seniors.
Yeah.
It's not very accessible. And where I'm at in California, there are programs with the hospital, like Stop Falls or Matter of Balance. Now, Matter of Balance, I really gravitated to it because it's in the different counties, and you can actually, we were the first for-profit company to be offering it to the community. And I thought the tips that they actually have in the program was vital. And it actually, like I said, some people are nervous. They're like, where do we start? You don't know
Yeah.
what you don't know. And so this offered them, here's where you start. Just, you don't have to do too much all at once, but here is a guideline. And you can actually start slow and build, but at least, and people are different levels with their fall risk.
Yeah.
So that being said, and it's an expense that we have to, for our society, have to be mindful of. It's very expensive. And once somebody falls, especially when it comes to a hip fracture, that sets them up to be bedridden or bedbound. And a lot of people, it really impacts their quality of life, if not lead to them dying.
Exactly. Most seniors don't realize, and I hear this all the time, oh, walkers are for old people. They're 80 and 90 and they're still not seeing themselves in reality. But most seniors don't realize that falls are the number one independence robber of seniors. One fall can keep you from ever returning home. The other thing is that most people don't realize is our homes were built for young bodies. They were not built for the aging body. And that's why you have to make adaptations to your home over time and help yourself ensure that you can stay there a longer period of time. So I'd like to ask you, what are some of the most common but often overlooked safety risks you can find when doing a senior home safety assessment?
Oh gosh, the simple thing, okay, when the rugs, every time you go into a home, sometimes people have, I don't know, there's people that love a lot of rugs. Now, those are trip hazards. They're
Yeah.
easy to just move to the side. Another thing to be mindful of is the lighting. And
Yes.
as far as you just mentioned, the homes are not built for folks that to age in place. There
Yeah.
are home modifications that can be done, and like as simple as adding a grab bar when you're getting into the home or even into the bathroom. Now, most falls occur in the bathroom, in the and because it's wet and individuals tend to be, it's slippery, and so that's one thing that we've learned over time, to be mindful when somebody's in the bathroom, or put a door hanger. So if you're in the home or you have an elderly person with you, living with you, they put a little door tag on the outside to let you know they're in the bathroom. Okay. And so that way, if they've been in there too long, you are need to check on them, because it could be quiet, but I would honestly say I've dealt with customers that had a really near fatal fall, and they were in rehab for months. And that's incredible to get through that. But that happened in the bathroom. And so I want to just let folks know, the bathroom, you also, the other thing too that people overlook is just the clutter. A lot of times there's too much things in the way. and our depth perception changes, and as we age as well. So we can't see things very clearly. So clear that space. And sometimes individuals are in a home that is not an open floor plan. It's you have corners, narrow hallways, and
Yep.
big bulky furnitures or furnitures you don't use anymore.
Exactly.
And then you just have to really get rid of the things that you really don't need and clear that pathway as much as possible. You have to make it about your safety. It comes down to that, as simple as that. Make it about your safety, not about things. Things are just there. They created memories and you have those memories. So now it's time to get rid of those things that can actually be a detriment to you.
Exactly. I have a younger brother. I'm 72. He's probably 67. He is
Mhm.
married an older woman, and his wife is hard of hearing, and she's in the early stages of dementia. He came home one night from, they own a restaurant. He came home from work and was in the bathroom. She was already in bed, and he had been working at the restaurant all night, and he passed out in the bathroom and fell on the floor and was found 10 hours later, and he was close to death.
Mm.
He had undiagnosed diabetes and his blood sugars were sky high. But because his wife was hard of hearing and she was sleeping, he didn't get help until she got up the next morning and found him. So those things do happen, and people really need to be aware that they need to put systems in place for those times, because and it's always the caregiver doesn't think it's gonna happen to them.
Mhm.
Spousal caregivers are just as at risk for falls and injuries, just like their family member, that their loved one they're taking care of.
Exactly, yes. And we know that the caregiver has to carry so much stress that
Yeah.
sometimes it really impacts them more than the person they're caring for.
It really
Caregiver burnout is really a thing.
The statistics are 63% of family caregivers become seriously ill from the chronic stress or even die before the
Mhm.
person they're caring for. I really encourage family caregivers to really practice self care, get help. I encourage them to build a care team partner group, but that's a topic for another day. One of the big questions that issues that I have and obstacles that I find that caregivers and family members have a hard time overcoming is they don't want to make changes to the home because they don't want to make it feel like a hospital. How do you help caregivers and family members overcome that?
First, it has to be actually, it has to start with the mindset.
Yeah.
And then I think once you explain to them why you're recommending what you're doing, then they start to buy into it and they can see it. And they have to come to a point where they're ready and open for those suggestions, such as, okay, I might not be able to make it to the bathroom at night. I'm unsteady on my feet. My recommendation is do something very simple. Okay. You can actually have a 3-in-1 commode in the bedroom, or you can actually use a disposable adult diaper or underwear so that you don't have to struggle to get out of bed and get to use the bathroom or the commode. Those are the simple things. And so once you try and I always believe start, you have to start where you and them can have agreement so they can buy into that agreement with you. And then they can see the bigger picture as things get where my question is, do you think you are going to get better over the years? Or how can we support you so you can be independent, making your decisions at this time in your life, and so that someone else is not coming in making it for you. Now I'm giving them the power to tell them, hey, I I am the one going, I'm capable of doing it right now. I don't want someone coming in when I have no ability to think for myself
Ex-
rationally and doing it for me. So when you encapsulate it that way, they feel like they have autonomy. They feel like they have a way of making decisions for themselves without being forced to do. And you're always talking to them. You're not trying to treat them as a child. So they understand better. This is the reason for this particular item here, or this is what I'm telling you is these are the reasons as to why you should be doing this. And as you go along over the space of a couple hours, they're like, okay, they can see what they can do, and you really empower them. They really, after that 2 hours or 2.5 hours, it's almost as if they were the ones to make all the decision you told them to do.
Exactly. And that's the important thing is as long as they think it's their idea, you'll be successful. Vanessa, I recently had a situation where I have a Ask the Experts section on Caregiver Relief, and I got this email saying, hey, I'm 71, I have a history of MS, multiple sclerosis since I'm 15, and I'm looking for robots to pick me up, to take me to the bathroom. And I went, whoa. So I started, because there are caregiver robots and there are things that can do that. It makes me cringeworthy because I worry about skin tears and all of those things. So I started asking her why she wanted that, because she didn't want to have to depend on somebody to help her up out of bed. And she uses a scooter to be mobile. Anyway, I did a lot of research, and she was worried about getting up to go to the bathroom so many times during the night. And here I am. I'm like, she didn't know there were female urinals. She didn't know that there are these new systems where you can not have to get up, and they have a process. I don't know the names of the products. The women can use them, and they have a drain that will.
It's Pure Wig. The Pure Wig.
Thank you. I could not remember that. Pure Wig. I said, there's so many other alternatives that would be less costly. That's the other thing. I go for the most cost-effective approach first, and then we'll move on. But that was an issue. And it was a learning experience for her, because she says, women have urinals? I said, oh, yeah, they've been around for forever. And it enlightened her. It really did enlighten her to less costly approaches to her issues. And I said, there may come a time when you were going to need somebody to help you. And I was trying to break that into her slowly. And the sad part is she was living in a continuing care retirement community, and she has help around her all the time. And she's still in independent living, but she doesn't want to ask for help. And that is a personal growth experience that we all have to face as we get older. You just have to accept the fact that sooner or later, because I know I'm fiercely independent. I've cared for people all my life, and I don't want to be a burden or anybody to take care of me. But as I age and my years of nursing have just ruined my body, have chronic pain, I just have to accept that, yeah, there's somebody going to have to take care of me one of these days. And I just have to learn to accept it graciously. And that is my own personal struggle that I go through and that I identify with the clients.
Sorry, Diane. I just put in there, it's actually in our society, it's a societal problem because we are always thinking of ourselves as an individual, right? Yeah. So we don't want to ask for help, and we don't want to be a burden. But in a true community, that mindset, that way of thinking is not there.
What? I want to hug you right now. I think we've lost that sense of community.
Yeah, because I hear that time and again. I don't want to be a burden to anyone. And that builds in stress on the individual because they feel like they're trapped and they have no way of truly helping themselves, and until they are in a situation where they get hurt. And I would say that in a society where you do have a community, that thought is not in there, and that
it's not in there. Yeah,
that's not in their head at all, because it's an honored tradition. You take care of those that are vulnerable in your community. You take care of those that need help, and they don't even have to ask. And no one thinks twice.
That's beautifully said. But I grew up with a big Irish family, and we always pitched in. Somebody gets sick, you're bringing them food. And I grew up with that community. But because we have a society where everybody lives somewhere else now, and we don't have those strong family ties like we did, we've lost that. And we really need to come back to that. I really believe that, because we've got so many aging seniors now, and loneliness is a big issue.
And isolation, yes.
Oh, it's terrible. Vanessa, many families are really overwhelmed when it comes to choosing the right medical equipment. Now, I go crazy with this because as a rehab nurse, I see things and I just want to fix them. And I know it's not my place when I'm out in society. But how do you guide people to the right choices?
Okay, first of all, it's going back to listening. Okay. What are their needs? Who's there to support them? And how strong are they? And is this a temporary thing, or is this going to be something that is lifelong? So first, I need to get some of those things clarified. And what are they really thinking they need now? And so sometimes I have to assess whether that matches up with the equipment they think they are trying to buy. Because I've had a situation where an individual was in a wheelchair, just, I believe, from a fall, and they were actually still trying to get back on their feet, but I think they were pushing themselves way too quickly to do. And so they came in to try walkers with a seat. And I saw that they were unable to even stand, much less walk. And I said, this is not, come back later on when you actually can get out of the wheelchair and walk better, because right now this 4 wheels is not where you need to you do not need to incorporate a device with 4 wheels to help your mobility, because you're not ready for that. So
That would be a disaster. Yeah.
I had to send them back and say they did come back.
Mhm.
And then that was the time to observe them using the rollator and to see if they can actually navigate with the rollator safely. You have to be very cautious when you're having someone use a device with wheels, because it can go too fast, and they don't know that they can still control it, or their mobility is so limited, they can't pick up their feet, they shuffle. So there's different things to observe with how someone is actually using a walker. Or it could be as simple as they just need a cane. Or if they have instability on right and left side, I tend to go with a very simple folding walker. It all depends on what I'm observing. And it's nice to know that they can try it versus looking online. So many people are purchasing things online, which is inappropriate for their needs and very unsafe. So when they're talking to a community expert that can support them where they are, you can be like the safety coach.
Yes, exactly.
But
I'm sure that's what sets HealthQuest personalized equipment settings apart from big box stores and online suppliers. And I want you to address that. You go through a process to make sure. We just discussed this a little bit, but people don't understand that we've lost that ability. It used to be the physical therapists were able to help us and get the right tools, but that's not covered by insurance anymore. So it's ignored. And there's so many mistakes made. Oh, it makes me sad because it causes injuries, and some you're never able to get over because lack of knowledge.
Exactly. And Diane, what we said all through this interview is empowering people with knowledge. And the fact is that this is really where this is something that's near and dear to my heart. And I really think that people are suffering needlessly when it comes to this area, because when you have all of us brick and mortar stores in your area, which is a dime a dozen, you can go in and what that expert is going to tell you, that DME expert should be telling you, is saying, okay, asking you what's your height, what's your weight, and fitting you to that equipment.
Yep.
Just making sure everything we do in our store is we fit the individual. We're not going to say, just there's some walkers over there, there's some canes over there, there's some lift chairs over there. Just go try it, see what you like.
Yeah.
None of that. Never, never. I'm talking about it's so imperative for me to know height and weight. And then also, as simple as how are you fitting? How do you get off of that walker with a seat and doing it safely? How do you fold it up? How are you going to put it in your car? Are you the one putting it in your car? Can you even lift it? Is it too big and bulky? Very simple things, but even just the safety aspect of, I'm thinking from, they're taking this home. I don't want them to cause them to fall. I don't want them to use it incorrectly and then they fall. So the biggest thing with us versus someone shopping online is that you get that personalized experience when you come to our store. You get to make sure, and that safety, the knowledge of being safe.
Yeah.
So that's a big nugget for it. And we are actually wanting to be transparent, tell you what is appropriate and not appropriate, and how to properly use a device. Because these things is not like you're driving a car, but some of these things people have described, this is my mode of transportation, right? This is my car. This is my Cadillac or whatever they want to call it. And they like to they like to feel independent and safe. But I know family members that are younger like to make the choices for them. And sometimes you hear mom, or they order it online and it's not put together correctly. So that is also another safety peril. So in everything we do is at the backbone of our store is actually making sure things are safe for the individual, making sure they have the knowledge of how to use it properly and stay safe. And if things change down the line, they're going to come back to us. If they need a repair, if they need brake checks, brake replacement, or other things of the sort, we're accessible. We're accessible. And that's something you don't get when you get online.
Oh, it's something you don't get in the big box stores either, I'll tell you. I recently had a neighbor come home from the hospital. They said she was independent, but they sent her home with a wheelchair. No bedside commode, no home assessment of any kind was done. She had 17 steps to get up to her bedroom. There was no bedroom downstairs. Long story short, she came home and she couldn't get up the steps, couldn't get into the bathroom, fell her first 30 minutes at home, which if I had been there, I would have sent her back to the hospital, but I wasn't. And the student nurse, my roommate's daughter, was helping them. And when she ran out to this, she told the husband, go get a bedside commode, the potty chair. And he comes home with the cheapest thing. Now, his wife, God bless her, she's almost 6 foot tall. And she's a big, stocky girl, not overweight, but just strong. And it was just a challenge. She didn't even have a bed. They didn't even have a recliner in the room. They had these bamboo kidney-shaped chairs that they used to sit in that were swerved. She spent a whole week in that. It just made me crazy because we couldn't get a hospital bed for her. The facility wouldn't order it for the. It was just a nightmare. That's the kind of thing that's happening right now in our world. And that's why I'm focused on educating, like you are, the public, that they need your mom and pop stores in your community are the ones to go to for this kind of help, because you are going to get the personalized service that you don't get anywhere else.
Yes, that's so true. And Diane, I have to tell you that those situations happen all the time. There's a crisis right now. The family's having a crisis. Somebody's being released from the hospital and they don't have what they need at home. So we're the bridge and care for that until they can get the insurance sorted out. So we can say, okay, I know not a lot of people can afford all of these things, but rent them. And so when you rent them, then you can, even with us, we are a Medicare provider. I'm like,
Mhm.
we can turn that rental into, if we get the order sent over, we can actually transition it over to the insurance. And so we can actually be that bridge for you to make sure your loved one comes home to something safe. If they need a hospital bed and you think that's what they need, even if it's for a short time, you know,
Yes.
go
Yes.
ahead, go ahead and set that up.
Yeah.
And then let's take care of the insurance later on. But the thing is about making sure they are going to be safe at home when they're discharged.
Yeah.
And so you can always navigate that. If we are not the person that you're going to get these things through, and the insurances say, I want you to go to an in-network provider that they prefer, then at least you can transition. You can
Exactly.
you don't have to be stuck. And that's another thing people don't understand. You can actually not have to wait on the insurance or wait on the doctor to call in an order. But and a lot of times you have to be your own health advocate for you or your loved ones. And
Exactly.
so that being said, that's where the bridging care comes as well in the community, that we are accessible. And
Mhm.
if you need something right away, chances are you can get it the same day. And I will move really fast. I will move as quickly as possible to get that item out to the client's home.
And you know what? That's different from the big box stores and online too, because
Mhm.
they do it in their time and in their way. And one of the things we lack in the country right now is good customer service. That's
Mhm.
what I love about your kind of organization, because you're a hidden gem in your community that has a valuable resource that people need to learn about. Vanessa, I have something else I wanted to discuss with you. I just recently had a client who was in acute rehab. He has MS, had back surgery, and has neuropathy, diabetic neuropathy. And he was in the hospital. They sent him home after 14 days. He was not ready to come home. And when he got home, he was only home 2 hours and they had to send him back. He fell. It was just a nightmare. But this is happening right now. But what we discovered, and this is what I'm moving towards, is diabetic shoes. The man developed a huge pressure sore on his heel. Now, as a rehab nurse, I was mortified and angry because that's preventable. And in acute rehab, how does that even happen?
Mm.
But it's happening now because of everything's buddies pushed through, and it's all about money, not about quality of care anymore. And I can say that because I know I've been around a long time. But and what I was also surprised at is he didn't have any diabetic shoe. He wasn't wearing diabetic shoes. So I would really like you to explain why they are so important and what people need to know about getting the right fit.
Yes, that is because I have a history of my father having he passed away several years ago, but he was a diabetic, and so many of my aunts and uncles on his side. Again, the people don't know what's out there for them. A lot of people don't know that this is a covered, especially if you're diabetic, this is a covered item through your insurance. So, the most important things to know about the therapeutic shoes, or orthopedic shoes as they call them, is to minimize and prevent the development of ulcers, okay?
Yeah.
And possible amputation. So these shoes are designed they have to meet a certain criteria. They're not shoes that you can go into the store and just purchase. Okay, so the first thing is just the make of the shoe, how it's supposed to help with stability and balance. And the sole of the shoe, or the shank area, it only bends where the forefoot is. It's not going to be, so these shoes are not twisting. They're not going to be very pliable. They're really supportive. And inside, they have to be made of breathable material. So it can be leather, it can be like a mesh material, but it has to encase the shoe so that there's no rubbing and friction developing. And a lot of times, people will develop blisters or the likes due
Yes.
to shear, that part of the so it's the shoe, and also the shoes, it has to be fitted to them properly. Once again, you come in, you're not picking out a shoe, you're going to be fitted. I'm going to do a foot assessment. I'm going to make sure that you have enough, your feet, the widest part of the foot, is going to be accommodated by the shoe. Okay. I'm going to also make sure that this shoe is not something, it's going to address the needs, because some people have swelling. Okay. Some people they're flat footed, and some people may have even need wear a brace. And also to look where the callus is forming. Where's those pressure points on the foot? We want to offload those areas. Yeah. And we want to make sure that we have, either with the inserts that we get, you get 3 inserts. And I'm talking from Medicare here. 3 inserts are covered annually along with a pair of shoes. And 3 pairs of inserts, yeah. And that, not annually, I should say, every calendar year, because some people think that, okay, got them in June this year, I'm eligible in June the next year. No, when the year changes, that's when you're eligible, okay? And it's so important for people to understand that this is a covered benefit. Yeah. And you don't have to worry. It's actually not utilized enough, because people don't know, or people will get their shoes and inserts and they'll take about 5 years to come back and be reassessed. In that part, when I do it, I am assessing the foot. I'm not just saying, let me measure you and then we'll pick some shoes and you're on your way. No, this is a more customized care. I have to look at the bottom of the foot. I have to check for protective. We're checking for how the neuropathy part, we're checking for circulation, capillary refill, we're checking for the pulse of the foot. We're also checking to see where we can make total contact with that insert better for the patient. So a lot of people tend to get custom inserts because it's needed and required, but there's heat moldable inserts. And again, that has to be total contact. We'll get that in and heat it up and make sure it's a good fit. And the other thing too is that once the shoes do come in, because everything has to be ordered, we make sure that the shoe is the right fit. Once again, observing them to walk, having them let us know if they can feel any discomfort. It's actually something that you have to do a lot of to become more in tune to what people need. It's not like going to the shoe store. These shoes are not available in the big box stores at all. Mm-mm.
Yes. Your commitment to personalized service has made such a huge difference in the lives of the people in your community. What's your vision for the future of HealthQuest, and how can our listeners connect with your services?
That's a great question. My vision is always to have like a team to expand that support to the community. Be there as a bridge, be there as what you call it, the safety net to catch people.
Yeah.
But also to expand on the idea of what is available, and to make sure that I can't clone myself to have a lot of stores all over the nationwide. But
Yeah.
the idea is to make sure that I touch as many people as possible, and they can be the ones to spread the information as well.
Yeah.
Because you wouldn't believe when you do give them that knowledge, they can actually pass that on. And I've seen it in person. It was like incredible. But yes, so the long-term goal for HealthQuest is to make sure that we are able to offer services that are also in line with what the insurance covers. And a big part of it that we do is the diabetic shoes, but also it could be mastectomy products. We do compression garments as well. Now lymphedema, if you have lymphedema, those garments are covered with majority insurance plans. Medicare has picked it up as well. So the customized approach is what we are focusing on, just building on that and making sure people have that one-on-one time to get what they need with us. And as far as we're located now in HealthQuest, it's located at 8820 Greenback Lane, Suite D in Orangevale, California. And you can reach us online. Our website is healthquesthme.com. And our phone number is 916-238-1700. And our fax number is 916-238-1701. Now, we can accommodate folks nationwide. Say you are, and this is on the topic of being a diabetic, say you need a continuous glucose monitor, then we do it that as well. And Diane, it's just, there's so many things out there that you find out that people are just in it for the wrong reason. They're in it for the wrong reason. And I can honestly tell you, being in this industry as a small community-oriented business, it's not about the money. Because if it was about the money, I would have already left.
You'd be a big box store.
Yeah.
I'd be just online.
Yes, just online. And it's about truly offering this idea of serving the community, being of service. And that's truly where it fills my cup up so much, because you know that you're not trying to get something out of them. You are trying to give them something.
Yeah.
That's sometimes not very tangible, but it's accessible to them. And that's something that a lot of time people like yourself already can appreciate that. And it's knowing that you are actually keeping people safer,
Yes.
even if there's not a lot of them that truly know about you yet. You're saving lives. It's one of my professors in school always said, make it about saving lives. And so that's what you're doing. You're just going out there and you're making sure that you can touch as many people as possible and make them safe.
My goal is to give everybody the knowledge and the ability to have a better quality of life. And that's what's important, I think. And we're losing that in our society at this point in time. That's why I love people like you with your wonderful organizations. Vanessa, thank you so much for spending your time with me today. I know you've got a busy day ahead of you. To my family caregivers out there, you are the most important part of the family caregiving equation. Without you, it all falls apart. So please learn to be gentle with yourself. Practice self-care every day because you are worth it.